Story 1. My sister went to a gynecologist because she had been having breakthrough bleeding for several months, plus really heavy periods bleeding through a tampon and pad every couple of hours and unbearable cramps that make it difficult to stand. Her abdomen was visibly swollen and firm, like she was pregnant. She could not button her jeans anymore. The doctor did not even touch her, just told her that every woman hates having her period. Take an iron supplement and 5 or 6 ibuprofen for the pain. She got a second opinion, who immediately sent her to radiology. She had a grapefruit-sized fibroid tumor in her uterus. Hysterectomy at 35. Story 2. A doctor asked what medications I was on, and I told him. He asked why I was taking them, and I told him I have bipolar disorder. He said, "Whoa, have you killed any kittens lately?" Story 3. Late to the party, but obstetrician/gynecologist. Woman, I went to get a birth control prescription and a checkup, and she found symptoms of trichomoniasis. She said, with utter vitriol, "We need to get this cleared up because I know what you people are like. If we don't treat it as soon as possible, you'll just spread it to dozens of innocent men." I was barely 19. I had only ever had one sexual partner and had been a virgin a year before. This was my second obstetrician/gynecologist visit, and I was lost and terrified. I'm 36 now, and I still remember that exchange. Probably will for life because what was that, ma'am? Story 4. Switched doctors when COVID-19 happened. Went to my new one and told him about my torn Achilles. He flat out told me I was lying. The old office sent my file, and he saw the ultrasound of my torn Achilles and changed his tune. Went back to him a couple more times due to a lack of doctors, and any issues he made me feel like I was lying. Went to a therapist, and he asked, "How long have you been struggling with depression?" I told him since I was a teenager, and he straight up just said, "No, you haven't." I just walked out of his office. Story 5. I tried to talk about consistently awful and painful gastrointestinal problems I had been having. She held a finger in my face and said anxiety, and refused any further action. Then she told me to lose weight because I was getting fat. I went to another doctor who was appalled and said, "Yes, it could be caused by anxiety, but that doesn't mean you have to suffer, and we should make sure nothing else is going on." She did some tests, referred me to a gastroenterologist, and I was diagnosed with irritable bowel syndrome. I was put on appropriate medication, and my quality of life dramatically improved. I think about that response sometimes. Could be anxiety, but that doesn't mean you have to suffer. Story 6. When I was in the mental hospital for self-harm, the doctor told me to have someone watch me do it to make sure I don't cut too deep like he did with his girlfriend. What? Story 7. I went to the doctor at 16 about my heavy periods and intense cramps. I was told that endometriosis doesn't exist, that it's just normal for girls my age to have bad cramps. 16 years later, I'm trying to have a baby and having an intake ultrasound at a fertility clinic. The ultrasound technician scans over my ovary and says, "Oh my God." She leaves the room, comes back with another clinician, and tells me I have an 8-centimeter cyst on my ovary. It's bigger than a peach, the largest she's ever seen, and I definitely have endometriosis. 1.5 years, countless blood draws, 1 magnetic resonance imaging showing stage for endometriosis lesions, 3 utterly failed in vitro fertilization cycles, and 1 laparoscopic excision of my tubes and endometriosis tissue weighing 5 pounds later. I will probably never be able to get pregnant using my own eggs because my body is so damaged by this disease. If my doctor had believed me half my life ago when I first brought this to his attention, I might have been able to mitigate some of this with medication, earlier surgeries, or even fertility preservation when I was younger. I've been dreaming of being a mom since I was little, and this may never happen for me, and it is devastating. Story 8. My psychologist had advised me to go to the emergency room for help if ever I was feeling like harming myself. So one day I did. The doctor on call sent out his assistant to talk to me. She told me to go for a walk next time instead of wasting hospital resources. I told her, in return, that if I went for a walk in that state of mind, I would likely jump off the highway overpass. I understand that exercise is good for mental health, but come on. I guess I still don't know how that interaction should have gone. But that's certainly not the kind of help I was expecting. Story 9. For something more funny, My father got COVID-19 last week, and I took him to urgent care to get some medicine. He does a nasal swab, and the nurse takes it off, normal stuff. The nurse practitioner comes in a few minutes later and asks my father, "Hey, how are you feeling?" "Tired." "Well, yeah, you have COVID-19. Wait, I probably should have said that a different way. Sorry, I'm attention deficit hyperactivity disorder, and my medication wears off about lunchtime. I probably shouldn't be saying that. Sorry, when I'm unmedicated, I talk a lot. I need to stop talking about my attention deficit hyperactivity disorder. Anyway, we got a Paxlovid prescription and a great story. Thanks, Mr. Attention Deficit Hyperactivity Disorder Nurse Practitioner. You were great." Story 10. I was at a gynecologist, legs spread open in front of his face. The old doctor looks up at me and says, "You're missing a bit of exercise, aren't you?" I was 15 and not overweight. Story 11. Not me, but I came across this guy in my province when he was in the news for unprofessional behavior. Dr. Terrence Davids looks like he is working in Saskatoon now. When he was working in Humboldt, Saskatchewan, refused to refer a woman for an abortion and tried to guilt trip her about it, asking how she'd feel about her dead baby in heaven. He's also refused to renew people's prescriptions for antidepressants and anxiety medications, telling people that they just need Jesus. Oh, he was also working as a pastor in that city at the same time. Story 12. It's sad and not at all unexpected that most of these responses are from women. Doctors are notorious for not taking a woman's pain seriously and not doing anything until something life-threatening happens. If then, no apology either. Story 13. I have two examples from two different doctors. 1. I'm happy to see you lost weight. I bet you'll even be able to get a boyfriend now because it probably would have been hard for you before. Just make sure you keep it off. You want boys to be attracted to you, don't you? I was a 16-year-old girl with her then-boyfriend in the lobby. We had been together since before I lost weight. Not that it mattered. 2. Okay. Let's hear about this anxiety of yours. I was in my mid-20s and mentioned to him during a blood work appointment that I have been feeling anxious about my father's stage 4 cancer diagnosis and the start of chemotherapy. Doctors can be real pieces of crap. If you find a good one, stick with them as long as you can. Story 14. I already posted, but just remembered this gem. I went to a dermatologist for hidradenitis suppurativa and wanted to discuss new skin issues related to the illness that had emerged on my breasts. I told her that my sweet husband didn't give a hoot, but it was really bothering me. She said, "Well, there are treatment options, but the one person who really matters doesn't care. So I'd say let's just leave it." I never went back. I also never paid the bill for that appointment. No regrets. Story 15. Not to me, but about me to my mom. At 8 years old, I started my period. Obviously concerned about how young I was, my mom took me to the doctor, who said, "Well, in some places she's now old enough to marry." To me, "Have a child now before you start chemotherapy," which I was due to start a day or so later. Story 16. During a checkup, my obstetrician gynecologist casually, as a joke, said, "If you ever want to skip the dating scene, I hear the speculum is great for those intimate encounters." I immediately changed doctors afterward. Story 17. Nurse here. The doctor says to me, "Don't worry, he'll forget all about it in the morning," after he slapped a demented elderly man across the face when the man wasn't being cooperative during an exam. It was reported to the administration, who did nothing. Story 18. I'm sporty, but I couldn't do those sports any longer due to pain in my knees. He looked at my magnetic resonance imaging scans and said there was nothing. Women's knees sometimes hurt without a reason. It's even got a name. It's called the knee pain of young women. He then proceeded to tell me I should do more sports because women's knees just hurt from doing nothing, fully ignoring that I came in for pain in my knees after doing sports. A year later, it's gotten worse. Another doctor and another magnetic resonance imaging later. I'm waiting for surgery as what was a little lesion before has turned into a larger, scarred lesion. And yet, this isn't nearly the worst thing doctors have said or done to me. I know for a fact that I've repressed a lot of terrible things over the years because I simply never wanted to think about it again. It's kind of buried there like a large meal in my belly that I just can't bring up to recall. Story 19. Not to me, but my mother. She was seeing the doctor about getting her tubes tied after having birthed her third and final child. Holding the infant in her arms, with a 4-year-old me playing with my dolls in the corner. The doctor heard what she wanted, looked at both myself and my baby sister and said, "Well, what if one of your kids dies? You won't be able to have another, because dead children are just replaceable like that, I guess." Story 20. You are just stressed. An otherwise healthy 19-year-old does not have gallbladder issues. 6 months of pain later, I refused to leave her office without further testing and a specialist. I was in surgery less than a week later, and they found out my gallbladder had begun to fuse to my liver. I was in surgery for over 4 hours for what should have been a routine procedure. I spent the better part of a year in agony, unable to eat just about anything that was not lettuce or bell peppers without feeling sick, just because she did not want to order the tests because an 18-year-old cannot possibly be sick. There are a lot of other issues, but that one sticks out. Story 21. My doctor has repeatedly told me I am too young to have arthritis, as I am 28, despite it being genetic in my family and my grandfather being diagnosed at 25. They are refusing to refer me for tests and scans, so I have basically just got to live with the pain. Story 22. A psychiatrist told me, entirely unprompted and on our sole meeting, that the reason I kept having boyfriends break up with me is because my voice is annoying. I talk fast when I'm nervous, and obviously I was with that man. What a prick. Story 23. I went to my doctor because I had a sinus infection that burst a blood vessel under my skin. My doctor was thinking I had been hit by my husband. After the x-ray, he realized I was correct. Then he had other medical staff come to look at what he said was their freak of the week. Story 24. Went to the doctor for a checkup. She asked me 0 questions about my diet and exercise habits and immediately launched into a lecture about how I needed to lose weight because once I had kids, I was going to get really fat. She also didn't ask if I wanted kids. I was 17 years old. Story 25. The doctor told my mom that my vomiting and awful pain in my abdomen was colic. 3 days later, I was having surgery to remove a ruptured appendix. This was after he called her neurotic. My own general practitioner as an adult told me that the sudden change in my periods, from medium/light and fairly pain-free to super heavy and excruciatingly painful, was because of my weight. I'm overweight and have been my entire adult life. It took threatening a formal complaint for her to refer me to gynecology, where it turns out I had several fibroids that needed removing. Story 26. Told my wife, "You have endometrial cancer, but it is the good cancer. You will get a hysterectomy and be done. Nobody ever dies from this cancer." She immediately had the hysterectomy and was dead a year later. Story 27. The gynecologist lectured me about how beautiful my body was and how removing the 5-centimeter cyst, we didn't know if it was cancerous or not, would ruin my body, make me lose friends, and how I would be ostracized and listen to different music. Didn't listen to anything I had to say. Then made me sign a waiver saying I didn't understand the surgery I was having. The gynecologist again commented on my body with the nurse before I was put under for my surgery. I was 19 or 20 years old. And oh yes, it was a woman. Story 28. As an 18-year-old, I was having infrequent short episodes where I couldn't talk or understand language. I went to the doctor, and she accused me of being a drug addict. I never drank alcohol or did drugs. I was young, so I was embarrassed to go see a doctor again. It turns out years later, after I had a tonic-clonic seizure, that I had epilepsy and a brain lesion that bled, which I was unaware of. Story 29. Let's just pretend for a second that I am the one with the medical degree. I had spent the last 5 years trying to sort out my chronic period pain, nerve pain in my hands, constant dizziness, and went in because I had started having stabbing headaches that made me drop to the ground incapacitated for a few minutes at a time. I made the mistake of doing a basic Google search and saying that my symptoms aligned with a few disorders. I was just trying to help, after feeling like I was wasting all my previous doctor's time by deigning to be yet another woman with unexplainable chronic symptoms. Story 30. He told me my health issues made him question why he became a doctor, and he wished I was in the emergency room for a broken leg instead of chronic bladder infections because I had a kidney transplant. He was a jerk. Story 31. I went to my doctor with some leg issues. I couldn't feel my right leg. It took immense focus to use it, and it was a recurring problem that I had experienced almost exactly a year before. The last time, a temporary doctor at the clinic had basically told me to walk it off and come back in a week if it was still an issue or got worse. This time, a different doctor was telling me the same thing. Both times, I went home, except the second time I returned the day after with my grandmother because, less than 24 hours later, I could not walk without assistance and had been unable to get out of bed without help. There was some concern this time, but it was also limited to let's send you in for blood testing. The test center was closing for the day when we arrived, so my grandmother drove me straight to the hospital. I ended up being in the hospital for almost a month and came out with a multiple sclerosis diagnosis. I haven't had a temporary doctor seeing me since, and my private medical practitioner takes me very seriously.